Back and neck pain can be debilitating and come with various causes and treatments. Here to share more is Dr. Richard Busch with Busch Chiropractic, and we'll get to the back pain in just a minute. But COVID-19 certainly on the minds of a lot of people, but you're still open in an essential business.
We are actually both the Department of Homeland Security and also Indiana Department of Health, or Board of Health, I guess is what it is, have deemed us necessary, and there's a reason for that. And the biggest reason is because we deal with patients with chronic pain. Most often when people have chronic pain, in a lot of cases, or if they have an acute type of a problem where things just flare up, first thing they do is they go, well, I either have to see my doctor or I have to go to a walk-in clinic, I may have to go to the ER. And the problem with that is there are a lot of people that might be trying to get to the ER who may have another problem. And so we've actually developed a system in my office where we can actually have patients check in while they're in the parking lot, so they can actually be taken exactly to the treatment rooms when they're ready. So it's something that we are working with. It's something that I think everybody is a little bit tired of hearing about, but at the same time it is something that's very important to deal with.
Right, because a lot of people do deal with that chronic pain, and that's back and neck pain. How prevalent is that?
It's extremely prevalent, and I think I told you just a little bit ago about a patient that came in, and this is the reason I wanted to talk about this today. This patient had been seeing doctors for injections, epidural injections for his back pain. He had sciatic pain all the way down the leg, had trouble walking, was having trouble working, was actually having trouble getting off the couch. So he was homebound anyway. And the interesting thing was they told him that he couldn't have any more injections. He was either going to have surgery or have to wait until this whole thing is over, because they're not doing that type of thing right now, or at least as frequently if it's voluntary. So that's when I started to think about this. Now, over half the people in the audience right now are going to experience debilitating back pain during the course of the next year. Over 80% of everybody is going to experience a debilitating back session during the course of their life. So it's something that's very important to talk about. And that's something that we use the DRS protocol to treat. I think I've told you in the past that DRS stands for decompression, reduction, and stabilization. And what we've done is, over the course of the last 25 years almost, we've trained medical doctors and chiropractors from around the country to utilize the DRS protocol to help patients avoid not only needless and unnecessary back surgeries, but also that life of debilitating pain. And so it's something that we've been able to see it change not only their lives, but all the lives of everybody around them as well.
And a lot of people are told they have to have surgery, but DRS is non-surgical,
Exactly.
Right?
It's non-surgical, safe, painless. Most of our patients actually fall asleep during treatment. Over half the patients I see have had at least one failed back or neck surgery. They've generally had multiple epidural injections. They probably have had physical therapy, seen other chiropractors. They've really done everything. And in a lot of cases, they're just taking medications just to kind of get by and deal with the pain. And so what we're doing is actually helping with their quality of life.
So much important information, and definitely don't want to just deal with the pain, want to get better for sure.
Exactly.
Dr. Busch, thank you so much for coming in. And you can find out more about Busch Chiropractic on their website. Pat, we'll send it back to you.